How do anti-motility drugs stop diarrhea? Imagine your digestive system as a busy highway with cars moving smoothly along. Sometimes, the traffic suddenly speeds up, causing chaos and making you rush to the bathroom. That's what happens during diarrhea. Now, anti-motility drugs act like traffic controllers, calming the rush and helping things settle down. They mainly work by slowing down the movement of the intestines, which is called peristalsis. Peristalsis is the wave-like muscle action that pushes food and fluids through your digestive tract. When these waves slow down, your intestines have more time to absorb water and electrolytes from the stool. This process results in firmer stools and fewer bowel movements, easing your discomfort. Many anti-motility drugs, like loperamide and diphenoxylate, target specific receptors in your gut called opioid receptors. These are found in the wall of your intestines, especially the mu-opioid receptors. When these drugs activate these receptors, they block the releases of a chemical called acetylcholine. Acetylcholine normally stimulates muscle contractions and secretions in your intestines. So, by stopping its releases, these drugs reduce the speed of muscle movements and the amount of fluid secreted into your bowel. This means less stool volume and a more solid consistency, which helps relieving diarrhea symptoms. Loperamide is a common choice because it binds to opioid receptors in the gut but doesn't significantly enter the brain. This limits side effects like drowsiness or dependence. It slows down the contractions and reduces fluid secretion without affecting your central nervous system much. Diphenyloxylate works similarly but is often combined with a small amount of atropine. The atropine discourages misuse because taking too much can cause unpleasant side effects like dry mouth or blurred vision. For people with sensitive stomach conditions such as irritable bowel syndrome or colitis, these drugs can be helpful to control urgent and frequent bowel movements. But caution is necessary if you have inflammatory bowel disease like colitis, especially if there is blood in your stool or active inflammation. Slowing down the intestines in these cases might worsen the condition or hide symptoms that need medical attention. In practical terms, anti-motility drugs are usually used for short-term relief. They help your body absorb more water and electrolytes, reducing the discomfort of diarrhea. Remember, they do not treat the underlying cause but can make symptoms more manageable. If you have a sensitive stomach or chronic digestive issues, it's best to use these medications under your doctor's guidance. That way, you can avoid complications and ensure you're treating your condition safely and effectively.